Representative Eileen Cody, we're going to actually introduce everybody. She's, of course, the inimitable chair of the House Health and Wellness Committee. Senator David Fraucht, who represents, of course, the Fighting 46th District and chairs now the Behavioral Health Subcommittee of the Senate Health and Long-Term Care Committee, is also the Democratic caucus lead on Ways and Means for the capital budget. And Representative J.T. Wilcox, the minority leader in the House and one of the most thoughtful and influential Republicans in Washington State and really on the West Coast. So I appreciate all three of you being here. And of course, Senator John Braun, the minority leader in the Senate, will be here in just a moment. There. Representative Cody, let me ask you, as we start this off, 2022 legislative session, how does it feel on the cusp as things are about to enter what I think is, just doing the math, I think were you appointed in 94? Did you get elected in 94?
Appointed and elected. I mean, appointed in this summer, sworn in June 2nd, 94, then ran right away. So yeah,
so
a while.
This will be your 28th legislative session. Wow. So what does 2022 feel like in terms of legislative sessions within the context of your career?
Well, I think that the overriding issue is, of course, the fact that we're going to be virtual again this year. And that's the sad part about things. I'm hoping that the House will be reevaluating every 2 weeks as we see Omicron hopefully drop as quickly as it spiked. We're hoping that we'll have some at least partial in person on the floor before the end of the session. But I would say the hard part is not being able to have caucuses and to be able to talk to everybody face to face, to be able to negotiate on some of the issues. It makes it a lot harder, and I'm sure everybody on this call would agree with me that makes it harder to try and negotiate things. And I joke about some of our freshmen that they think they've had a session, yet they haven't been in the caucus yet, to be hazed. And they're going to find out that life's a little different when everybody's in person. You don't get much body language out of Zoom, or the eye rolls, or laughing because we're all muted. So that's the thing that I think some people have failed to appreciate, and they will when they get to be more in person.
Senator Fraucht, I wonder, a lot of folks were speculating ahead of the 2021 session that because of the limitations of Zoom and virtual and not being on the floor, not being in caucus, that there might be less legislative activity, less legislative energy heading into 2021. That was not the case. That was not the story of the 2021 legislature. In 2022, do you think this will be a calmer session because of elections, because of virtual, all of that, or will this be another energetic 60-day run?
Well, thank you for having me, DJ. I appreciate the chance to be here and represent the Senate Democratic Caucus. And before I answer the question, I just wanted to offer on behalf of our caucus, I think this is the first forum we've had sort of with a bipartisan, with our colleagues on the Republican side represented by Senator Braun. I just wanted to offer our condolences to, on behalf of our caucus, to the Erickson family, to the Erickson daughters, and to our friends on the other side of the aisle who I know this has been a very painful time with the loss of Senator Erickson. So I just want to say that. And to answer your question, I think it will be an energetic session. Last year, I think it was a lot more productive than we anticipated. Frankly, when we ran through before the session, when we were deep in the pandemic, we were having technical problems. We didn't know if we were going to be able to do more than 1 or 2 bills an afternoon when we were in the session. Once the technical glitches got worked out, I think the voting went relatively smoothly. It wasn't always perfect. We had hoped this year to be on the floor, and the plan was that the senators would have to be there to vote in person until just a couple of weeks ago, and just earlier this week there were some modifications. So we're going back to a similar plan where there will be about 1/3 of the Senate on the floor at any one time. I personally think that we should be able to operate at some point, I hope, safely after the wave of Omicron, which I hope will peak soon. And so then when we get into the meat of the session, we can operate and vote in person with masking, with the social distancing and the testing regime that we put in place. I think that is optimal for the state Senate if we can find a way to do it. And that's certainly what I hope will happen.
Senator Braun, I want to ask you also about operations, but first I want to ask you just to speak to what's happening in your district and whether there, are rising floodwaters and what the status is of a region that sometimes gets hit pretty hard by flooding. How are things in terms of river volumes and the like?
Yeah, thanks for the question, DJ. Yeah, we're watching it pretty closely right now. A combination of some of the melt off from the snows we've had over the last couple of weeks and the rains in the last, especially in the last day. We're at, or maybe not quite at, but approaching a record flood level in the Newaukum, which is one of the main tributaries into the Shaler River Basin. Right now, the other tributaries are not as high, and the Shaler doesn't look like it will be at the level that, for instance, we saw in 2007 or 1996, where it flooded I-5 and many homes and businesses. So I think we're all kind of watching it pretty closely. Right now, it looks like we could get through this with some flooding and some damage, but not at the levels we've seen in past floods. So stay tuned. It's going to be an exciting day and a half, hopefully, and then it'll start to pass in the Shaler River Basin.
What are your thoughts as minority leader in the Senate about operating the legislature, operating in the upper chamber in this time of COVID? I know there's always this push and pull that our other guests have already spoken to in terms of the interest in being in person. And of course, we want to be in person here today, but the reality is that we are not, and that you will have a modified approach. What are your thoughts in general on operating the Senate in this time of COVID?
Well, thanks. And just as David did, I want to take a second just to thank David for his kind comments about the passing of Senator Erickson and his family. And that's not something he's just doing publicly. He's one of the first to reach out to me and others and express his concern. So we really very much appreciate it. It is tough, very difficult for the family. I very much appreciate the folks that reached out and offered their thoughts and help. So as far as the Senate operations for this year, a couple things. One, look, I think the surges should be taken seriously, and we have to think hard about what we do in response to it. There is no question, and I certainly respect the fact that the majority, rethought that and decided they wanted to change how we operate during the session, at least in the early part. I look at the same thing. I think we take it just as seriously. I come to a slightly different conclusion. I think that given how far we've come in terms of broadly, in terms of vaccinations, in terms of understanding how it spreads, and probably most importantly, testing. And the staff here in the Senate, and I suspect in the House as well, have done a great job in setting up testing for both members and for staff to make sure we're safe. I mean, without getting into the benefits of the vaccine, we know right now that the current surge, it may not protect you from getting infected. It may help you in terms of the long-term effects or the severity, but so we're just testing everybody. And I think as long as we're doing that, there's a good argument to say we could be in person, at least more in person than we're planning to do right now. In particular for me, the floor is certainly important. I'd like to see us find a way to allow the public to engage on a personal level. I think that's a big missing piece over the last year and coming this year is how can the public engage with legislators in person? And I don't know for sure if they'll take us up on that. That's really not the point. The point is that they have the ability to. So while I respect that they wanted to rethink the rules, and I understand they're in as the majority, they're in a governing position, I would come to different conclusions. And I just simply relate it to schools, right? We've been through this with schools. We know there's more to their overall well-being than just public health. And just like that, that's true for the legislature. At the federal level, the administration is pushing hard to keep kids in schools with their Test to Stay program. I don't know why we can't do something like that in the legislature. And I hope as we get more comfortable with the situation, better understand it in the coming days, we shift and we get us back in person. Because, as we discussed earlier, the ability to talk to each other, to understand each other's perspective is really important to getting this right. Often we all come from lots of different places and our worldviews are certainly different. But I think broadly we do a decent job of listening to each other when we're in person, and not so well when we're remote. And so I'd like to get us back there. I'd like to think we can now, but I certainly appreciate the majority's has to make the decision, and they did. So we'll move forward and hopefully we'll get back there.
Representative Wilcox, how does being the leader of the loyal opposition in the House change in this time of COVID? Do you have to think, because you're not, able to coordinate in person and not able to collaborate across the partisan aisle? How does your role as leader of the opposition change because you're not in that in-person setting?
Well, I think there's two major things. And first of all, opposition by its nature is forced into some level of reaction. We don't set the agenda. We respond because the speaker and the committee chairs decide what the agendas look like. So you have to be very nimble. And in some ways, all of the electronic tools that have, we've become adept at make communications quicker in certain ways. I'd like to go back to what Senator Frock, or maybe it was actually it was Representative Cody, talked about. A caucus is a complex organism, and it is much more productive when you have people face to face in the same room, because you especially in the House, it's a team sport. And you need to be cooperative. And the crazy thing is, we have our four teams, these four caucuses, but then you figure out how are we cooperative with these teams that you think are opposing, and you only do that really if you can openly talk about things. And the caucus exerts a certain amount of discipline too. I don't mean a mean discipline. I mean a discipline that says, let's think this through. Let's be careful what we say. Let's go ahead and air our ideas, but then let's walk out of here with the best ideas, not the worst ideas. And I don't think that happens when it's all electronic. The other part of being the loyal opposition, and we should take the loyal part of that very honestly. We're not here just to represent, our team, our party, or even just our district. We've got to understand that we've got an important role to play in the government of the state of Washington. And that doesn't mean that our bills get passed. It means that our job is to engage with the majority, sometimes slow the process down, and do everything that we can to make sure that whatever passes, whether we're opposed to it or in agreement, is still the best possible product. And I think we've all failed at that. There were immense mistakes made last year, especially in the area of public safety. We failed to take a look at the flaws in the long-term health care bill that had been passed the year before. And now it's going to be put off for 2 years because, apparently the session isn't enough time to really think about it. This is a deliberative process. And the only way that you get a good product out of it is if it's actually a two-party system. And you have that when the public is engaged, not in 30-second increments. That's the biggest disaster I can imagine, when you have a lot of people interested in the bill. And so what happens is you have this immense quantity of people providing 30 seconds of input. That's absolutely quantity and not quality. And you also are set up in such a way that if people want to have a bill that doesn't really reflect a cross-section of opinions, it's really easy to ignore people. And that happened last year. And one of the things that I want to do this time, I've tried to be a collaborative person, and sometimes you succeed, other times you fail at that. I'm going to be much more aggressive this time, and I think the majority party has maybe learned from the experience of last year too. We cannot accept flawed bills that sometimes are designed to address tragedy, but bills that create even more tragedy. We cannot do that again this time.
Senator Frock, let me ask you to follow up on that a little bit. The Long-Term Care Trust Act, as Representative Wilcox has suggested, does have legislation to forestall that, and the governor's talking about that as well. The police reforms, of course, there are a lot of calls, from bipartisan calls to review some elements of those bills, and of course, capital gains is in the courts and doing its thing there. What about this argument that in COVID, in a virtual space, actually policymaking does not, maybe is not as productive as it is in person, and that things should slow down as a result?
Well, I think what my friends, Representative Wilcox was referring to was the quality, not as so much the quantity. from his perspective. I obviously have a different take on the quality of the legislation that we passed overall. I think there were a number of important things we did. To take capital gains, just to take I think the easiest one first. That's been passed. It's in the courts. We're going to see what happens. It's not generally been built into our budgets in the immediate, so we have enough money to cover the immediate revenue that was supposed to bring in if it is overturned in Douglas County, but then it's obviously going to be appealed. I don't know what's going to happen. I honestly don't know how that's going to play out. So I think the capital gains issue is not really germane at this point to the 2022 session. Long-Term Care Act, our caucus came out publicly based on the input from our members and said, look, the goal here is a good one, which is to provide for the long-term care needs of people where the market is not working for many, many people. It's certainly people at the lower and middle incomes who can't get coverage or can't afford the coverage they can get or can't get benefits when they actually need the coverage. So this was a social insurance program that we tried to set up, but clearly there were some things that needed to be addressed. And so we came out for the delay, and I'm fine with that. I supported the delay, and we'll see what fixes will ensue. I hadn't heard about a 2-year delay. I'm not quite sure what Representative Wilcox was referring to, but we did discuss this just in our caucus yesterday. And my understanding is we're hoping to see if we can figure out how to reform it. But the long and short of it is delay and the implementation of the collection of the tax is not going to take place, or hopefully will not take place in the immediate. We're going to try to work on that quickly. Your final question was, DJ, about which bill? I'm sorry.
I had also just mentioned police reforms in the calls.
Yeah, the policing reform bills. Look, I mean, that was a very complicated, difficult issue. We have a very different perspective than our friends across the aisle on the need for many of the reforms. I think you're going to see some efforts to perhaps revise some of the standards or that are under a couple of the bills, particularly 1310, which will allow for some different standards when involuntary treatment of people is necessary and police need to use tactics. There have been, I would say this, I don't think it's all one side on everything has been terrible. I was in a conference just the other day with the Algona police chief and others who have said to us that they were able to implement the bill and the standards under it and have not had problems in implementation that some of the other departments have had, but it's a legitimate issue. And so where there are problems in bills that we pass, we have an obligation to go back and try to fix them. So I think you'll see us move in that direction.
I want to highlight to folks who are with us that you can pose your questions in the text box there. I see Jim already has one question up, and I will integrate those as you all kind of sort them and prioritize them, and we'll get them into the conversation as well. So don't be shy. I know you're not a shy bunch. Representative Cody, let me ask you about this element that Senator Braun spoke to in his remarks about kids in schools. I think if people want to feel sad, they can look at how our kids are faring and their mental health. Is it okay? How do you sort of balance this idea that it's okay for kids to go to school and be in person year round, but it's not okay for the legislature to be in person and meet? How do you think about those two things?
Well, I think, as he said, that the increased testing for the kids in schools is the way that they're trying to deal with it. And I guess that I don't think that the legislature has the same mental health issues if we don't meet in person that kids do. I mean, we are adults, or most of the time we act like it. And so there's the difference in just where we're at in growth, and the fact that the kids do need to have interactions with one another to be able to mature and know how to work with one another. So I think that's trying to keep the kids in schools is it has its dangers, but that's why we're trying to increase the testing. And but I think that it's different for the legislature, that there's not a real reason that we need to be in person. We don't have to be in person. We showed that last year, that we could actually get our work done.
Am I correct in recalling that children's mental health policy is still in a different committee, not in your committee?
Yes, but we work together on it. Yeah, but it is.
Yeah.
It's still in children or early learning and whatever. I can't remember. It's Representative Sen's committee. I don't remember the name of it.
Yeah.
We change the names all the time.
Yeah, I should mention, DJ, in my new role, you're going to see some efforts in the children's mental health space coming out of. I know we're going to be working on some legislation on more outpatient treatment options, as well as different levels of care for children who need it, and also integrating behavioral health into pediatric primary care settings, which is very important.
So within that context, Representative Cody, of the struggle, the mental health struggle that I think many people in Washington State are feeling, and the acute implications for many of our young people, what are your thoughts on Medicaid policy in general, and how Medicaid policy might respond to COVID? Not just things like the public health emergency, where we might, we have allow folks to stay on the rolls for extended periods of time if needed, but how does COVID change Medicaid policy moving forward?
Well, I think that COVID has shown really some of the inequities that we have, that many of us have known for years, but that it really has highlighted it. And so I think that we'll see some change, try to improve in those areas, trying to make sure that on equity issues. Also, I would say that the COVID has totally improved our telehealth and moved that forward. And I mean, Washington State has been really in the lead on using telehealth. We've had the telehealth collaborative. Former Senator Becker was really a pusher on, that was JT's seatmate. And she really was a strong leader on telehealth and made sure that we were moving forward on that. So I'm happy that we had a lot of things in place that other states didn't, and we were able to meet the challenge that way. And really, in behavioral health, it is telehealth is really becoming a primary delivery system for our telehealth. Which, since most of the psychiatrists in the state live in King County, it's a good thing, so that we can actually get some more behavioral health treatments out into the rural areas.
Representative Wilcox, I wonder, as you are thinking about the pantheon of issues of that come to the legislature and to your caucus, healthcare seems today, in January of 2022, to be much less partisan and much less divisive than January of 2011. Do you feel like, as you scope and consider the different issues that come before your caucus and the legislature as a whole, that healthcare is a little less partisan today than maybe some other issues, or is it? Do you see it right in the mix?
Well, it's interesting you mentioned 2011. I remember we used to get gavelled for using the phrase Obamacare. And then after it passed, we could use the phrase again. So it got a little testy for a while. I think in the House, it's in part a tribute to two long-serving legislators. That's Representative Cody and Representative Schmick. I think each caucus put the very best person they could have in those positions. For Eileen, starting much longer ago, I think Joe took that over about 12 years ago. Neither one of them backed down, but I think they're both pretty committed to finding what you can do in common. And, I think the other thing that the House Republicans try to do is, let's not fight yesterday's battles. Let's move on with the context of today. And I'm sure that, we've had some partisan things. Washington State is making steps towards universal payer. And that's not something that we believe in. And so those things are partisan, and we try to pick our battles. And then when we can be productive together, we should grasp those with both hands.
Senator Braun, I think it's accurate that the sort of ability of a caucus to put forward meaningful, innovative policy, thoughtful policy is really dependent on any one or two or small group of senators digging in and doing the work. I think we've seen some interesting, innovative proposals out of the House Republicans, for instance, already heading into the session. How do you see health policy as a central policy amongst the many that the Senate Republicans can dig in on? There are fewer Senate Republicans than House Republicans, for instance. Is heading into the rest of the year and elections and moving forward, are we going to see deep dives on healthcare out of the Senate Republican caucus that can be noodled on and discussed, or is this kind of a lower priority topic for your caucus because there's so many other very important ones?
I'd be hesitant to call it a low priority. It's a very important part of the public policy arena. That said, after, oddly enough, after 2 years of a pandemic, where we're all worried about public health, many important issues like healthcare have kind of gotten, I don't want to call it back burner status, but they haven't got the focus. I mean, whether you're talking about healthcare or housing prices or homelessness, these are issues. If you dialed the time machine back to 2 years ago, we were all very focused on these things, and we kind of life has just been challenging for a while. So I like to think that we get back to this. Healthcare is a particularly hard thing to engage in a short session, especially. It's complicated. It's not always, the divisions are not always partisan. Often you're trying to resolve issues between friends in terms of medical providers. That's very hard to do in ways that are fair and work well for the public. So it's complicated. And certainly underlying this, we have, I think, kind of different long-term views about how we ought to serve the people of the state of Washington with healthcare, whether it's universal payer, which we are not very excited about, or more engagement with the private sector. I think these are just long issues. I don't think even in a good year where we hadn't been coming off 2 years of a pandemic, or maybe we're not quite coming off yet, I guess I should say. It would be hard, but I think in this year it'll be really hard. So I think what you'll see, my view of what you'll see is from healthcare is we'll try and solve some of the very more pressing, practical problems that we can work together on to make sense. Workforce issues are a great example. Whether you talk about the nursing challenge we have around the state, how do we deal with that in a reasonable way that is fair to everybody, or mental health workers, long-term challenge, and we have a very immediate need, but a long pipeline to get it built. And we're working on it, and we have worked in a very bipartisan manner in that area with setting up the campus there at Northwest for the University of Washington. That's going to be great when we get on board, but it just takes time. So I think what you hopefully see, what I hope to see is find places we can work together in a short amount of time and solve real problems. We'll still disagree about some big issues, but I'm not sure those are going to get addressed or fixed this year. But we can do some good work in the meantime.
Representative Cody, I wonder what your thoughts are on the revenue situation that the state faces. It's a really good one. And for the first time, at least in my view, for the first time ever, the Economic and Revenue Forecast Council projects a revenue for the biennium in excess of $60 billion. I recall those difficult choices back in the Great Recession and the cuts that had to be made. Is this a time to make needed investments with those really strong revenues to increase the strength of the safety net, or has much of that been done and now is the time maybe to build up reserves to make sure that when a rainy day hits, we're ready?
Well, boy, good question. Everybody has spent that money, I think, 10 times over from all of the requests that I have received. So it's going to be an interesting year, of course, because because there is money, everybody wants a piece of it. That's always the way it works. I think that I know we'll be doing more investments in behavioral health, because we all know that we don't have a system that's working great there. And it's a frustration because I think we really have worked together, bipartisanship on behavioral health, long-term care, but it's just a frustrating area, and we really need to help build that system and make it a better one. And then I expect, because of the extra money that different groups got during COVID for hazard pay, there's a discussion about continuing that. I know our long-term care workers, both in the nursing homes and the home care workers, are all thinking that we need to continue that funding. We already talked about the workforce shortage and needing to put more money into so we can train and we got to get some faculty and the workers at the bedside. So there's definitely places to spend the money. And what we have to be careful about is making sure we can continue those investments and that we don't set up ourselves for a bow wave. So that's what I will be looking at.
Representative Cody, some years ago, you'll recall that in one of our keynote sessions at State of Reform, I asked you, you were on a panel with, I think, Jeff Rowe at Premera, the CEO, and two other, maybe Preston Simmons, at the time, the CEO of Providence Everett, and one other senior leader from the market. And I asked you,
Are you going to embarrass me with something I said 10 years ago?
No, well, I don't know that it's embarrassing, but I asked you that. I said, some people think that if left to their own devices, the healthcare sector, the private sector will just never move quickly enough, that they will always, because of monopoly pricing power or because of other kind of things, prices will just, they will not self-correct. If they would have self-corrected, the market would have already taken care of that. So my question was, do you think that it requires legislation to force the healthcare sector to do something to address prices, to do something to address quality? And your answer at the time was absolutely. Do you still think that? And has that opinion changed?
Absolutely. And no, the opinion hasn't changed. I would say that over the years, the thing that I have been the most frustrated with is that, employers pay for a huge amount of the healthcare system, and that they haven't driven the healthcare system to provide better, cheaper and quality coverage. They just pay whatever they get asked. And I think that's part of the problem. And that's why when I get frustrated, it's something I would think my Republican friends would want to work on to try and bring down those prices. And so I'm always surprised when I come up with an idea that would hopefully start curbing prices and I don't get some support. But yes, I absolutely believe it's as I think when we were talking earlier, I said it's always about money, and it goes from every angle that people are just trying to make more money, and that's it. Nobody's trying to really bring down the prices.
Representative Wilcox, I know you would like to see, I believe you would like to see the market in general work its magic, and in many sectors it does in terms of price and competition. As a former business person who had to manage a budget and saw the cost of healthcare in your P&L, I wonder what your thoughts are on this idea that Representative Cody is sort of speaking to, but I'll put it a little differently, which is there are only two places where healthcare gets funded. It either gets funded through premiums or it gets funded through taxes. And if employers are paying the lion's share through premiums for our healthcare sector, that is a heck of a drag on business. What are your thoughts on this question of government's role to try to control prices?
I'm trying to organize my thoughts because there are so many dimensions to this. First of all, government and healthcare is so enmeshed right now that there's no private market out there. It is some level of government involvement, no matter what. One of the biggest impacts on the cost of insurance to private payers, businesses, as Eileen points out, is the fact that government doesn't pay its own way. It just decides, here's what we're going to pay for services, and the private sector has to make up all of the difference. So that's a real problem. But there was a huge opportunity. You mentioned 2011. Before I was elected, I was deeply involved in the milk processing business across the country. And there were a number of private sector, large private companies, Safeway most prominently in the Northwest, who were going around the country presenting a new kind of private insurance involvement that would incentivize the best behaviors, the healthiest behaviors, require that people paid their own way when they were making the worst choices. And it was a new horizon for the private sector business involved in how costly healthcare would be. And that all got wiped out. That to me is the biggest tragedy of Obamacare, is it closed down this discussion that was becoming very, very, very innovative. And maybe there's some more room for that from the tech companies. You keep hearing that they have these things that they're working on, and I hope that they continue to do it, but that was a huge missed opportunity. The other thing in Washington that I think has damaged what we're doing is it used to be far easier for medium-sized companies to be self-insured. And my company, when I was CFO, we were self-insured in a few states, up to maybe 500 or 600 people. And when you involved your staff in what kind of coverage are we going to have, and what's the company going to pay for? What are you going to pay for? They get super creative and super invested. And what we have now, I think, is a system where the payers are very much separated from the actual health, and there's very few incentives that seem to have direct impacts anymore. And it's a tragedy. And I bet that we could get a little innovative on this too if we put our heads together, because I think the truth is what Eileen has talked about is things that we all want. We want better prices. We want competition. We want innovation in the space, but we don't have it right now.
So Senator Frock, you've been in the mix in a big way, as have folks like Representative Cody, in the mix on public option and fighting that from day one, sponsoring legislation in the Senate. I've appreciated that you have come and spoken at some of our conferences in places like Colorado and elsewhere to talk about it. I wonder, now that you are on the cusp of your last legislative session, on the cusp of stepping down and retiring, congratulations, by the way, from the Senate, what are your observations on passing meaningful healthcare legislation, particularly your observations and your lessons learned on passing the public option bill in Washington State?
Well, thank you. Well, first of all, it's Representative Wilcox and I actually were in the same class of House members in 2011, so we've been friends for a long time. I disagree with him quite a bit on kind of his take on kind of where we are. What I would say, if you think about the ACA, the reason the ACA is taking shape, or it's basically taking root, is because a conservative Supreme Court has now upheld it 3 times when various states and other entities have tried to overturn it. So that's number one. It's here to stay. And I think from my perspective, when I came in 2011, my view on the ACA was we needed to have a mechanism in place from a consumer standpoint to protect people from healthcare bankruptcy, which so many people were facing. And why is that? That is because they either didn't have employer sponsor coverage, they would lose their job and not have an option to have a decent plan and would just go without insurance. And then they would get cancer and be bankrupt, and families would be bankrupt potentially for generations. And the ACA changed all of that. And if you just look at what happened with the pandemic, and you look at what happened and why it's so important to have the government involved is in a safety net, both in the Medicaid space, the Medicare space for our elderly, which has been in place now since 1964 and 65 and is ingrained in our society. And then also with the limited parts of the individual market, which is only 6 or 7% of the people. In 2020, when the pandemic hit and we had skyrocketing unemployment, our uninsured rate in the state doubled from 6 to 12%, 6 to 12%, DJ, and then it went back down. And where did so many of those people turn? They turned to the individual exchange market where they could get subsidized coverage and at least have some protection in the event that, God forbid, somebody got sick during the middle of the pandemic and had cancer or some other ailment besides just getting COVID. So, and that has gone back down. So all of these things, I'm not saying they're perfect. The ironic thing about the public option, and we went through it, and maybe some of your guests were watching our previous session on this. I don't claim that it is perfect in any way. We've got work to do. It hasn't driven down premiums as much as we wanted. However, it is expanding coverage options in rural counties. And I've always wondered why we can't get my Republican friends more engaged on this, because we're not coming in saying the state's going to offer a plan. We're trying to leverage the private market to offer plans and basically try to find a way to drive down some costs and standardize plans so that the out-of-pocket costs are better, and they have been under this program. So our program has actually expanded coverage options in rural counties where the uninsured rates are higher. That's what we've done, but they're not government plans, they're private plans. They're just regulated a little bit differently. That's the thing that people need to remember. So what we've done in this state, I think, has been interesting. It's been innovative. It's going to provide lessons for other states like Nevada and Utah and perhaps the federal government. I don't see anything happening on the federal government in the near term on the public option. So right now, we're it in one sense, and there are lessons being learned here of what's working and what doesn't work under this program. But it's important for us to innovate and try to fill in those gaps, and that's what I think the government has to do in the healthcare space.
Hey,
So,
DJ,
you can tell I get very passionate about this.
Yeah,
No,
let
that's
me
fine.
respond a little bit, and it's true. David and I are friends, But I think either I misspoke or you set up a straw man here. I said before, I'm not really interested in fighting old battles. I'm not trying to turn back the clock on Obamacare, ACA. But the question was really about, where is the private sector? Or at least Eileen was talking about where's the private sector. I've been around the private sector when it was really, really engaged. And, we need to figure out a way to get the private sector engaged because they can be again. David, I appreciate all that passion. It might have been slightly misdirected if you thought I was trying to turn back the clock.
No, I certainly didn't mean it to come across that way at all. And I appreciate your perspective, and I understand where you're coming from.
Senator Braun, I'll give you the last word here. What do you make of this conversation? And I wonder where you think the opportunities for collaboration exist moving forward across the party lines in the 22 legislative session.
Well, thank you. So I'd like to just address one comment that Representative Cody made before about private employers not going after the cost. I take some respectful exception to that. The way I look at this is, in our state at least, there's kind of four places where people get health care. There's the state health care, PEB, SEB, which is, in my view, is kind of the premium and frankly overpays for many things. You have Medicare, which is probably as close to the fair market rate as possible. And then you have Medicaid that significantly underpays. And then you have the private folks. And I can tell you my personal experience, I've negotiated, just like JT, I've negotiated rates every year for a couple decades now. And in fact, we pushed pretty hard there. We self-insured 5 years ago and have held our premiums with better coverage for our employees almost at no growth. I'd like to see anybody, public or private for that matter, match that history. And I don't think we're unique here. There are private folks out there all over the place trying to figure out ways to deliver care for their employees at an affordable price within their business strategy. And it's an important part. We're in a workforce battle, right? We're all trying to attract the best people, and healthcare is an important part of that. So I think you're not giving the private sector enough credit there. They're working really hard, but understand there's a lot of regulation out here that we have to comply with. Some of it, useful, some of it not as useful. And then we are being asked, because Medicaid in particular is so underfunded relative to the cost of the services, that the private insurance are asked to subsidize that, and that is a long-term plan. I think this is obviously very, very complicated, and I think I believe folks on both sides of the aisle, certainly the folks we have with us, work in good faith to try to solve this problem. And I don't think anybody is not interested. I think everybody is interested in providing good coverage. I think one place, and another comment I wanted to follow up on is especially David mentioned about coverage in rural areas, and I don't entirely disagree with him, but we have to understand coverage in rural areas is not the same as care in rural areas. There's a disconnect. Because you have coverage doesn't mean you have access to care, and there's a lot of ways we've worked together to solve this. We talked about telecare earlier, and that's part of the process. But also, I just go back to, we have an opportunity. I should say, I don't think this is a solvable problem strictly from a governance standpoint. It has to be a multi-directional approach to this problem, including engaging the private sector, the insurance companies, the private employers, engaging with government to provide the regulatory environment to be successful, and not squashing innovation where it exists. I can go on some more about some other options we've looked at as we've looked at the best coverage for our employees that I think would be very both cost effective and, more importantly, in my mind, provide better care, but they're not available in scale that we could use around the state. And so I just think we need to keep an open mind, keep working together, recognize it's a hard problem, solve the things we can right now, work on the practical problems, and eventually we'll figure this out. Government is tricky and hard and complicated, and I think we'll get there eventually, but it's going to take some time.
DJ, can I just say one quick thing on this? Very quickly, I agree completely. Medicaid rates are too low for our providers. I think I see Eileen nodding. We all agree on that. The interesting question is, and I'm very skeptical, is if as we do increase Medicaid rates, and we have done that, and we are continuing to do it, we are not seeing a corresponding reduction in reimbursement rates that the providers are demanding or accepting when they go into contract negotiations. That is not a thing. And so somehow somebody, and maybe it's just the government through some of the direction that we've given, Cascade Care was one attempt at it, is trying to provide some kind of forcing function in that.
And hopefully the Healthcare Cost Transparency Board will show us where the money's getting spent.
Right.
Because that's my goal with that, was that we'll raise Medicaid rates and lower the PEB and SEB costs. And hopefully when we lower the PEB and SEB, the rest of employers will be able to lower their costs too. So that, because as you said, the complaints from what I feel is that the employers buy the argument from the hospitals and the physicians that they have to have these exorbitant rates because Medicaid's underfunding them. Well, we got to see, really, they seem to manage to make a profit. That's my point. So.
Well, we're going to leave it there with the dean of the House providing the last word on this. And I will just say, when we first started state reform, we wanted to do this, in 2010, where the Affordable Care Act passed and was signed in March, and then the Tea Party election happened as a response in November. And so our first conference in January of 2011, came with the idea that there ought to be a place where you can get thoughtful players around the table where we can, agree to disagree and disagree agreeably. And I just am so honored that you are here and having this conversation, and that I will say each of you have been just phenomenal and top of class, not only as policymakers, but as friends of state reform. Pretty much every time I've asked you to do something, you've said yes if you could do it. I know, Representative Cody, you had a birthday that got in the way a couple of times, but we'll let that slide. So Representative Eileen Cody, Senator David Frock.
Nobody ever asked me to do anything, so I'm always available, man.
Senator John Braun and Representative Jake T. Wilcox, I appreciate each of you being with us.